for joining. This webinar is being broadcast on social media platforms, Facebook, YouTube, and LinkedIn. If you have any questions, you can send them via Q&A or Facebook Live. We're now going to go ahead and move into the questions we have. And our first one is, in relation to the fact that flu season is among us, how do you plan to delegate your staff accordingly to patients that may show symptoms of COVID-19 and the flu?
Well, first of all, I'd like to thank everybody. I'd like to thank the Hispanic Chamber. Ms. Moreno, I appreciate you, and thanks. So I think one of the things that people need to understand from a hospital standpoint, right, is that because of COVID and the fact that COVID has been amongst us in this global pandemic and the epidemic in El Paso since essentially March or April, we've had a lot of practice, right, with understanding how to triage patients, how to manage people that are coming into the hospital. And we may get to this later, but the signs and symptoms, the fever, the cough, the shortness of breath, a host of things that go along with influenza also go along with COVID. Right? And so from a hospital standpoint, we're prepared, right? We understand people coming in with what's called ILI or influenza-like illness symptoms. We'll triage them, we'll test them, and then make the appropriate decisions around getting them into the hospital or potentially sending them home for follow-up with their primary care, or just potentially self-quarantining at home.
Very good. Okay. And then access to proper PPE has been a challenge that many hospitals have had to face in light of the pandemic. Has proper distribution of PPE among departments been implemented due to the upcoming flu season, or do they vary across departments?
Oh, so again, I think it's important for people to understand that influenza is just an additional, right? So I think about this as a recipe. This is like, we already have the paella recipe. Influenza is going to be adding the pepper or potentially paprika or salt to it. We've had PPE. We're blessed to be part of the HCA network, the largest healthcare network in America. And so from a PPE standpoint, whether it's surgical masks that we give to everybody that walks into our hospital, whether it's gloves, hand sanitizer, bouffants, the shoe covers, N95s, depending on what they're doing, we've had those and we continue to have them. We've had people called PPE czars, or sort of our PPE quarterbacks that make decisions on where they go in the hospital at various points in time. And so I think the key takeaway here is that flu season is not new or any different to us than the rest of this year has been around COVID. It's the same situation. It's the same things that we plan to do. And so from a hospital operations and clinical and sort of strategy and planning standpoint, it's important for the community to know that nothing has changed, right? It's not going to be necessarily more difficult, other than people are going to come into the hospital potentially at a higher rate. But from the operational standpoint, we're ready, and we've been ready. So I think that's the key.
Oh, that'll be really important for everyone this season. Okay, and then unforeseen circumstances can be intimidating. How do you feel that you're equipped to handle both COVID-19 and the flu?
Yeah, so again, I think we're ready, and that's the shortest answer. I think that we, in a sense, unfortunately, because COVID has spread so much in our community, have gotten preparations around everybody else in the healthcare community. Right. So I think if you sort of take this back to March and April, and we sort of locked down and we didn't have an understanding of how to manage COVID. Now we're in October, right? We've been doing this for 5 or 6 months, from the ER, which is the front door of our house, to the hospital, to potentially the ICU if people are getting sick. The strategy remains the same. We are excited because we have multiple testing platforms. We have multiple rapid tests. We're working on an in-house test that should be available in the next 2 weeks, rapid flu, rapid strep. And so there's a host of things that we have that I kind of call our armamentarium, right? Or our weapons against managing this that we feel really comfortable about. And so nothing has changed.
Okay. And how important is it for everyone to get a flu shot this season?
Oh, flu shot's absolutely essential. And I know there's a lot of controversy. We live in a time where basic things seem to become controversial. I've gotten a flu shot every year for the last 20 years. At the very minimum, my kids get flu shots. I really don't see flu shots as something that should be controversial. People talk about, well, I got a flu shot and I got sick. No, I think it's important for people to understand that any shot you take, just like any medication you take, can have side effects. You can have local side effects. You can have what's called systemic or generalized side effects. Some of those may just be pain and warmth in your arm. You may get a mild fever. You may feel a little bit run down. That's really your body kicking in, right? So that's how the vaccine should work. It should stimulate immunity in your body, and different people have different ways that they manifest or react to that. But the flu shot doesn't make you sick. I think that's the biggest myth that we should dispel. And I think this year, especially where we have COVID existing, influenza, understanding that we hope that influenza is less, and we can talk about that in a little bit. I think taking influenza off the table by getting a flu shot and reducing your potential sickness rate if you do get that flu shot, and if you do contract influenza, it's going to be really key to get especially vulnerable populations and kids. I mean, I think everybody should get it, but if that's the decision we need to make, it'd be vulnerable people and kids.
Okay, very good. All right. And okay, so and what are some of the more distinguishing symptoms of the flu versus COVID-19 that the public should be aware of before they decide if they would like to be tested?
Yeah, definitely. So I think we sort of categorize that as something called ILI, or influenza-like illness. The sort of standard symptoms that people would complain about would be cough, shortness of breath, maybe a fever, body aches. I think that sort of categorizes both viruses. If you then focus sort of on COVID on its own, I think what's interesting is that we've heard about the loss of smell, the loss of taste. We've heard about the COVID toe or the COVID joints, where your joints get blue or purplish, right? And so those are COVID specific. But in general, what we've seen is that people coming to our urgent cares and the emergency room, the majority of them have respiratory symptoms, right? So that shortness of breath, cough, fever, body aches. And so that makes it difficult to distinguish. And so again, that's where we're sort of excited and prepared around the ability that we have to test people for both, right? Or for all, and really be directed and hopefully as quick as possible to get them into the right situation. I will say this, the city and the county specifically, as well as the hospitals, have really done a great job in the way they've grown their testing capacity. I've actually had friends that have flown in from Houston that needed to get tested so they could travel out of the country, and they've flown into El Paso to get tested, understanding that they could get a result 24 hours later and then taken off for international travel. So I think really exciting, and that's kind of cool. So we continue to do well in the city. I think the city has to take some kudos for some of the work they're doing. Our numbers are going up again, and so we really have to be careful and really sort of double down and not get complacent, and understanding that people are frustrated and tired of some of the things that we've had to do. But it is where we are today.
Okay, very good. All right. And amongst the media, there's been a lot of chatter of a new strain of the flu. How will the medical community confront this type of public concern?
Yeah, so again, I think the key there is that amongst the media, right? As an
Yeah.
infectious disease physician, I don't really worry about the strains of the flu. Back in a former life, when I did research, we used to look at those kind of things. But the reality is that there are different strains every year. Every single year for the last 20 plus years, we've had a different strain of the flu, and we manage it, right? So that's where the vaccine comes into play. I think people shouldn't get bogged down with what type of flu exists out there, the medications for it, primarily the preventative care about vaccination. I think we're in a space where everybody should understand that wearing a mask shouldn't be controversial anymore. I got hand sanitizer somewhere here, right? Getting your hands clean, physical distance. And when you're sick, I didn't feel great Sunday and Monday, I didn't come to work, right? And had a job to do. But I think that's where we really have to focus on. I think it's also important, and this is hope not being a strategy, but there is some hope that if you look at the Southern Hemisphere, so Australia, New Zealand, South Africa, where they usually get flu months before us, and they're in their flu season, their flu rates are down 90 to 99%. Primarily because they've been doing all these things that we should be doing, right? So the social distancing, the mask, the hand hygiene. Flu travels. And so because people are not getting on planes back and forth between the Southern Hemisphere and the United States, there is some hope that we will reduce the amount of flu we have. We don't know just yet. Flu season is starting, people are getting vaccinations. But again, really important to continue to do those sort of basic preventative or what they call mitigation strategies to reduce your risk of not just influenza, but coronavirus as well.
Very good. Sounds like a good strategy there. Okay, and let's see. So how will you avoid spread to patients that have already tested positive for COVID? You've already talked about the precautions that you're taking in the hospital.
Yeah, some of the similar things. So, I mean, obviously, our job in healthcare is to protect patients and help them get better, right? Help them transition out of the hospital after their stay. I think our healthcare workers have done an immense job. They're strained, they're tired, just like the rest of the society and community is tired. And so, again, because we're doing universal masking, because our healthcare workers, primarily our nurses, techs, physicians, are all masked, doing proper hand hygiene, we truly don't believe that there's a risk of reinfecting or co-infecting somebody in the hospital. We don't yet know, and this is not a hospital issue, but sort of theoretical, we don't yet know what happens to people that get so-called co-infection, right? When they have an infection of influenza and the coronavirus, that will be yet to see. But yeah, we would hope that we will not be transmitting healthcare worker virus to patients. That's just not the way it should work. And we're really comfortable around that.
Very good. And if someone has had COVID before, can they get it again?
Yeah, great question. So it's unclear. I think there is some data out of the Far East. We've had some data out of the United States where people that had gotten infected with COVID before have then gotten COVID again and been sick. What seems, if you sort of look at the totality of all the reports out there, that even if you do get it again, your immune system revs up faster, right? And so it's like, oh, I've seen you before. I recognize you. So it's like facial detection on your iPhone. Oh, I know who you are. I'm going to move some immunity cells to block it. And so people aren't getting as sick. Again, very small numbers. It's really hard to generalize off of these small numbers. And so the idea is that you probably can get it again, but you just won't be as sick.
Okay, well, that's a relief. All right, and how will you support your staff as they take on the task of caring for patients during such daunting times?
Yeah, I think we're in a time of our human history, right? Obviously, we weren't here in 1918, where people are scared, people are frustrated, people are concerned. And it's not just healthcare workers, it's our community, right? And in as much as, there was the sort of catchy phrase of healthcare heroes, I feel like we're kind of beyond that, right? We show up every day to do our jobs, and that's our job. We chose healthcare. Understanding that there's stress and anxiety that goes along with it. And so we have multiple support systems within the hospital, whether it's from a mental health standpoint, we have employee forums, we have something called the I Care Award, where we reward our employees that have gone above and beyond, right? And so it's really important for us to continue to consistently show and reward people that are doing their jobs. I think that's number one. I think number two, from a communication standpoint, we have regular directors meetings, right? So we actually just had a directors meeting yesterday evening. And so we get that education, that information out to the directors get it to their teams, whether it's myself, my boss, David Shimp, the CEO, a host of the other leadership team, Andy Garcia, our CNO. We then break out and also meet with our other sub teams, right? So we walk the halls daily. We're available for questions. My door is to my right over here. It's an open door policy. So anybody can knock, come, email, text. I probably get 100 to 200 texts a day from not just our team members, but people across the city and sometimes the country asking questions. And I try as much as possible to get back to them. So I think over communication is the key. And that's why I really am proud of the Hispanic Chamber for doing this, because getting that information out into the community is the number one way to avoid these myths, fallacies, and misinformation and miseducation. So that's really what we focus on and try to be about.
Well, thank you so much, and we really appreciate you taking time out of your day to do this as well. How are the flu safety protocols and updates? Okay, so the constant flow of communication is what's key, is what you mentioned. Is there anything else as far as public communicating with you all besides these types of webinars?
Oh yeah, definitely. So I think it's important for the community to know that from a CEO standpoint, so the representative of our hospital is our CEO. He's in daily communication, not just with the other CEOs of other hospital systems, but the mayor's office. I've been blessed, lucky, sometimes better to be lucky than good, right? I'm the co-chair of the El Paso City County COVID-19 Task Force. And so myself and Dr. Carranza are the co-chairs of that. And there's a host of knowledge, or rather a wealth of knowledge on that task force, which we give recommendations back to the city and the county. In fact, on the El Paso Strong website, the dashboard is there, what we really created with help from Battelle and working with them. So really excited. It's a one-stop shop for people to go and see what's going on in the community, right? So it's accessible on iPhone, mobile, iPad, computer, whatever it may be, and then that constant communication. As one of the chief medical officers in the city, I'm in constant communication with my colleagues at the hospitals of Providence and UMC, El Paso Children's as well. And so we have a text thread. We probably talk once or twice a month just to make sure things are going smoothly. And then as an infectious disease colleague as well, I have my other colleagues in the city that are on constant communication. So I think whether it's through official channels, unofficial channels, social media, things like this on Zoom, Facebook Live, IG, whatever it may be, I think getting people the information they need and providing them those resources that they can reach out to, that's really the key, the way I look at it.
Sounds great. Okay. And we know we've already talked about how important it is to get the flu shot. Where can people go to get one?
Really anywhere, right? So I think whether you engage with healthcare at a primary care level, a lot of primary care places give the flu shot, whether you want to go to one of our urgent cares like Care Now, they have a flu shot. I think what I recommend to people, right, is that there are multiple venues that you can get a flu shot. One venue isn't better than the other. Could be a Walgreens, a CVS, urgent care. I think the key here is getting the flu shot, right? Call ahead, make sure that you don't have to wait in line or wait in the waiting room to protect yourselves and others, and just getting the flu shot. But we're actually really lucky in this community because historically our vaccine uptake has actually been higher than the rest of the state. We saw that with measles and HPV and a host of other things. So there are multiple venues to go, and I think people just need to reach out and get their flu shot.
Okay. And I have seen where EP County has offered free flu shots. Are there any other avenues that people can look at if, let's say, they don't have insurance and do want to get that for free?
Yeah, I would actually say that the county and the city have done a great job. That would be my first recommendation for somebody that's challenged financially or doesn't have insurance. Just go through the city and the county. They make multiple arrangements to get people the flu shot.
Okay, that sounds great. Well, and I want to thank you for attending, and I know that our community has a lot of questions, so we're going to move to the attendee questions. And let's see here. All right, so our first one is thank you for doing this, Dr. Alozi, for this session. Do you think we will have access to the COVID vaccine in El Paso soon?
I guess it depends on what we define as soon. Are we going to have it or next week? Zero chance. Are we going to have it this year? Highly unlikely. I think what people need to understand is that prior to now, the fastest that we had gotten to any type of vaccine was 4 years, right? So Operation Warp Speed has sped that up. There are 4 candidates: Moderna, Johnson & Johnson, Pfizer, and AstraZeneca, right? That's through the Oxford study. They're all enrolling between 20 and 60,000 people. Some of them are 1 dose, some of them are 2nd dose. Majority are getting that 2nd dose this month. There's then going to have to be sort of a safety time, right? You got to wait at least 1 or 2 months to see what's going on. My expectation is that we'll have data and information about a COVID-19 vaccine this calendar year. Its availability and general use is probably a summer of 2021 event. And so I think that's really what people need to understand. And we need to set expectations that are rational, right? We can't be promising people that something's going to happen tomorrow and then continue to fail them on that. And so for our community, our strongest and most powerful weapon is mitigation and prevention. The 4 things that I talked about. And then by the time we do get to a vaccine in 2021, county and city are already making plans on the distribution chains. So I think that's really where we need to look at that.
Okay, that sounds great. And just as a reminder to the audience, if you have questions, you can send them via Q&A or Facebook Live. So we'll continue with the questions. How do I know the difference between having COVID and having the flu?
Wait, repeat that again?
How would someone know the difference between having COVID or having the flu?
Yeah, I think it comes back to that same question, right? How do we discern or differentiate them? It's actually pretty hard. Again, that category of what's called ILI or influenza-like illnesses, fever, shortness of breath, cough, that's the core. Now, with COVID, you may have loss of smell, loss of taste, but it's really hard to distinguish. And so, again, I think if somebody feels sick enough that they feel concerned about staying at home, it is important for them to engage with their primary care provider, visit our Care Now clinics, or come into the hospital if they're really sick. But I think that's where that discernment happens, is where you can be evaluated by a healthcare professional, and then we can test you appropriately.
Okay, and then kind of back to the question regarding the flu shots. Let's say somebody does feel ill, but they're financially challenged or don't have insurance. What avenues are open for them?
Best way to get tested is to go to the EP Strong website and click on the COVID link. It has COVID testing sites, and those are all run by either the city, county, or FEMA, or the federal government. And those are no charge to people without insurance. I think that's really the best way to go.
Sounds good. And once somebody gets tested, how long does it take for the results to come back with those avenues you just discussed?
Yeah, we're really blessed. And so, like I said, I've mentioned that I've had friends coming from out of town. On average, those results come back in 24 hours. If you go to some of the urgent cares or freestanding ERs, you may get a result back in less than 2 hours, right? And so we have really done a great job in the city as a whole, trying to ensure that testing is available, adequate, and timely. And so really excited to be partnering with a host of these organizations across the city that are doing a great job.
Very good. And once somebody gets their results, how are they notified? Is it verbally? Do they get an email, a text?
So it depends on where they are. I mean, if they go to a freestanding ER or an urgent care, they'll get the result before they leave, as long as supplies are available. If they go to the city line or county line, CVS, where Walmart, wherever it may be, it's usually about 24 hours, and they'll get a phone call unless they sign up for a text notification as well. But multiple modalities that people will get the results.
Okay. And then let's just say, for example, somebody does test positive at that point. What is the quarantine time? Who are they obligated to notify?
Yeah, so a couple of things. I think from a personal responsibility standpoint, once you've been tested, you probably need to self-quarantine, right? Because you've deemed yourself at risk or you've had symptoms. You don't want to spread to others. So I think you take yourself out of circulation and do quarantine. If that test then comes back positive, it's usually a 14-day quarantine period, right? Now, various employers may have ways to get secondary testing, and that's based on each individual employer, but on average, it's 14 days.
Okay. And let's just say somebody doesn't test positive, but they've been exposed to someone. Can they test too soon? Should they do multiple tests?
Yeah, great question. Really great question. So one of the things around testing is that if you've been exposed, day of exposure is unlikely to give you the proper test result, right? It's just too soon. And so we recommend in healthcare, the CDC guidance says this as well, usually test 3 to 5 days post the exposure. That's when your viral load is high enough that it can be picked up by a test. And so as you can imagine, if it's 3 to 5 days after, on average, somebody after an exposure is out for about 7 days until they get a test result and can determine whether to return to work or not.
Very good. All right. And is it true that COVID-19 can be in the air and be transmitted that way?
Yeah, so great question. There's been a lot of sort of back and forth conversations about what can be transferred, how it's not. I think the standard and really the highest data around it is droplet. So droplets, the achoo, you sneeze and you spray. And so that's why masks are so important. There are other times that it may be airborne, right? And so what we call aerosol generating procedures. So if we need to put a tube in somebody's throat, or we have to do an endoscopy, or a host of other things that can stimulate a large amount of spray into the air, that can be aerosolized. And it's in those areas that we usually use the N95. On average, what we understand is that that's not the key driver for the public or the sort of community spread. It's really close contact. It's people in small rooms, low airflow, not wearing masks, hand hygiene, super spreader events like we've seen recently.
Okay, very good. Here's another question. As an employer of a construction company, there is concern about the asymptomatic nature of COVID-19. Should we be concerned of something as simple as a sore throat versus it being just a cold or allergies? How do we handle this in the workforce during working hours so we can relieve some of the paranoia of the virus? We are trying to alleviate the workforce's fear of a runny nose leading to a COVID test.
Yeah, great question. And that's really hard, actually. I think one of the things that I tell people both here and across the city is you have to sort of modulate how we approach all of these things, right? The first question is, are they wearing masks in the workplace, right? So if they're wearing masks and as much as possible physically distanced, the true risk is low, right? And it's never zero, but it's low. I think we're in an interesting time right now because it's not just flu season, but it's allergy and cold season, right? El Paso doesn't get cold. I mean, I'm from Minnesota originally, so cold here doesn't really count as cold. But even as much as that is true, people start to go indoors more, right? And so as we go indoors more, we congregate and we get closer. And so people do need to be mindful, whether it's in a work situation or a family situation, that masks are still important where you can. Physical distance is still important when you can. If you do have signs and symptoms and you're concerned, get tested. I think that's really the key. If you feel sick, separate and test.
Okay, very good. And kind of around that same industry, if they're working outside, you still recommend that they wear the mask even though they are social distanced?
Absolutely. Again, I think we unfortunately have gotten into this space where there was some miscommunication around once you're outside, it doesn't matter, right? And I understand you can't always wear a mask, and the risks in an open space are less than in an enclosed space. But if you can wear a mask, I think it is ideal to wear a mask, understanding that there are going to be situations where you can't. This is not a hard and fast rule, right? And I know some people get sort of built into that dogma of you must do X, Y, Z, and if you fail at any point in time, you failed completely. I think of this as a package, right? You try to do those four things in the package, and then the risk scale slides back and forth based on what you can do. Working with the Texas Medical Association, we put out some standards around risk categories. It's on the TMA website. And I think it's a rational sort of consensus methodology to say, hey, these are the kind of things that are riskier than others. But I don't think there's any hard and fast.
Okay. And just to recap on the four things that you mentioned?
Yeah, definitely. So to wear a mask,
Okay.
wash your hands, physical distancing, and then watch your symptoms. If you're sick, try to separate yourself and isolate until you can get tested.
Sounds great. All right. And then our next question here from our attendees, should I get a pneumonia vaccine?
Yeah, so I think, again, that's a conversation to have with your actual healthcare provider. I think their guidance around a pneumovax or a pneumococcal vaccine, it's usually people above a certain age or who have various healthcare conditions. But I think without knowing more about the individual's health situation, that's a conversation to have with your PCP or whomever manages your healthcare. Some people need it, some people don't.
Okay, sounds good. So here's an interesting one. I've seen a lot of the people that have unfortunately passed away because of COVID have had underlying conditions, and diabetes seems to be the most popular one. Do you think people with diabetes are just more prone to getting COVID, or is it because of our Hispanic community that has a high diabetes rate?
Yeah, the answer to that is both. So I think when we look at diabetes as a condition, diabetes is really tough because it causes a lot of things, right? So it makes the blood flow change, it makes the blood vessels change, and all that is because of the sugar that's in our blood. And so when you have diabetes, it does seem as if people with diabetes seem to get sicker with coronavirus versus others that may not. And so if you're diabetic, control your diabetes. If you've controlled it, do the four things we talked about to reduce your risk of transmission. Now, in terms of our Hispanic culture, I mean, the data does seem to show that in El Paso, we have some higher comorbidity rates than other places in Texas. But I mean, if you look across the South, what's called there's the stroke belt, the heart attack belt, but that's all from essentially the tip of Texas to the Atlantic Ocean. A lot of it is just in the South. And so whether it's hereditary, whether it's genetic, whether it's dietary, a lot of it is dietary. We have some predispositions to it. And so that really what makes our community vulnerable. Right? And so that's why we have to take it seriously. That's why we can't say, oh, wow, look at this. Our numbers have dropped and then revert to 2019 or 2018 behavior. I think a lot of healthcare professionals have been really clear about this, that COVID is not just a 2020 event. It's not going to disappear because we hit December 31st at the stroke of midnight of 2020. It's going into 2021, potentially longer, until we get vaccines and better treatments around it. And so we have to continue to be diligent. We have to continue to be careful, understanding that nothing is perfect. I often tell people we have to be patient with ourselves as well. This is just a slice of humanity in the long history of humankind. It isn't fun, it isn't great, but it's not World War I and it's not World War II, right? So when we take it in a contextual manner, I think we need to be mindful of that.
Okay, very good. All right, and then for our next question, so they're asking, if I've had COVID, is it true that I'm immune for 2 months from getting it?
The conversation about COVID immunity is all over the place. It's gone from 30 days to 90 days to 6 months. I think what's important is this. If you've had COVID and you've been lucky enough to survive minimal symptoms, potentially have what's called the long haul syndrome, the constant sort of fatigue and the rest, you may not suffer from severe symptoms if you get reinfected, but it's important to understand that irrespective of if you've gotten it before, you can still get it again, harbor it in your nasal passages and your hands and transmit it to somebody else, right? Not the previous infection, but a new infection. And so it's important, irrespective of whether you've gotten it or not, to continue to be careful because you can still give it to somebody else in the future if you get a new infection. So the immunity conversation, we expect the human body to respond faster to a second infection than the first one. That's just what the human body does. But again, you can still be a vector of transmission. So people still need to mask up and be careful.
Okay, sounds good. And as far as internationally, do you think, or is the US going to be looking at what internationally other countries do and how they are attacking COVID as well?
I mean, I think the international healthcare community have been pretty solid around the major recommendations. We had a sort of a head start when it happened in China, the Lombardy region of Italy, across Europe into England. And so this is a global issue right now. And I think all countries are taking sort of best practices from other countries. We really do in the United States have probably some of the best healthcare in the world. And so we know what to do when somebody is sick and comes into the hospital. Unfortunately, we're not always successful. I think what's more important for the community is not to minimize it, even though we understand that most people that do get this infection will be just fine. We still have to protect ourselves, protect our loved ones, protect our community, really. This community is not going to get back to normal until we can overcome this threat.
Okay. And as far as kids getting back to school, I guess everybody still practices the 4 things that you had mentioned. Do you see an uptick in cases now that school has returned for some?
It's hard to tell. I was having a conversation with the health department and Dr. Carranza the other day. The zip codes that have the highest rates and case numbers still seem to be in the Far East, 79936, 79938. Those also seem to be where we've opened school as opposed to some of the central and west schools. It's not necessarily a direct relationship, but it has happened. I mean, we sort of expected that as schools open, potentially there'll be more spread. Kids seem to continue to do well with this virus, knock on wood, and thank God. And I think here's the real thing. From a healthcare standpoint and from a public health standpoint, it's important for the community to understand that if we control the virus, then the conversation about school becomes so much easier. It's a lot more difficult to open up schools and teachers will be afraid and a host of other things when we haven't controlled the virus. And so as we're seeing our numbers start to trend back up, It's really important for us as a community to double down on our efforts and get those numbers back down so then we can open up school for our kids. I have a 9th grader and a 5th grader, and they want to go back to school. And so excited for them to go back to school, but only if it's safe for them and for me.
Very good. And everybody keeps talking about how long they think COVID is going to last. Any predictions on that?
I try not to be Nostradamus. That's usually how you fail when you try to predict things. But again, I think the important thing here is it's not a 2020 event or a singular 2020 event. This is going to be with us into 2021. I'm excited for a host of things. We know how to manage it more now than we did in March and April. We have multiple medications that we didn't have in March and April. I think vaccines will arrive sometime in 2021 for general use to reduce risk. And there's a host of what are called monoclonal antibodies. Regeneron and Eli Lilly have some that are probably going to be available by emergency use authorization later this year that can really hopefully reduce the risk of death in COVID. And I think that's really where we need to get to is if you come to the hospital, we have a collection of things that we can do to prevent people from passing away. And then the community at the same time continues to do their due diligence and take their responsibility until a time where we get a vaccine that reduces it even further. So it's a multi-step approach.
Okay, that sounds great. And as far as people that have not watched the news, what is the current state of COVID as far as the numbers? Are we increasing, decreasing today?
Well, let me take a look. I got a screen right next to me. It's the joy of the internet.
Yes.
So yeah, if I look at our El Paso, Texas situational monitoring website, we're at a positivity rate of about 10.7, which is actually the highest we've been, since August 8th. Yeah, since August. And we now have about 31.9 cases per 100, which is actually higher than we had back in August. So again, we're going the wrong direction. It's important for the community to recognize that and then sort of pump the brakes, as the kids would say, and really take responsibility. This isn't going to disappear because we wish it to be gone. It's not going to disappear because people feel frustrated and want to have Halloween and a host of other things. We have to put in the work, just like going to the gym. You don't go to the gym once and say, hey, for the rest of the month, I'm great. I've lost weight. I got muscles now. No, it's diligence. You got to put in that work. You want to see the gains. And so just like at the gym, COVID is the same thing. We need to put in the work to see the gains.
Okay, well, that's not great news, but as far as you mentioned Halloween, so I saw that the city has banned Halloween trick-or-treating parties. Did you see the same thing? Or anything new other than that?
Again, I got 2 kids, right? So they weren't thrilled by it, but I understand it. And again, I've had people reach out to me or text me and say, it's not fair. If I can go to the store, I can go to Halloween. And again, I think this is where people sort of get caught up in the rhetoric of this thing. You go to the store because you need food. You go to a drive-through, for example. I saw somebody put up that, well, if I can go to McDonald's drive-through, I can do Halloween. You go to a drive-through because you need food. Not everybody can afford grocery stores and to cook at home. Sometimes it is cheaper to go to the drive-through. We have various areas that are food deserts. Halloween is not a necessity, right? We don't need candy to survive. And our kids truly, in as much as this is a hard time for them, they're resilient. I mean, there are a lot of kids that I have friends that have kids. I'm like, why would they do Halloween, Daddy? Why would they do Halloween, Uncle Ogie? That's crazy. And so again, I get it. People are frustrated. They're upset. They want to return to their old lives. But we're not in the space where that's going to really make sense for a while, especially with numbers going up. If this was a month ago where our numbers were coming down, we had put in the work and we were really excited about the way the community was going, I think that's a totally different conversation. I think our politicians are looking at the data, and the data and the science is the conversation here that should drive people. And again, reasonable people can disagree, but I think you have a community event like that where multiple people are going to multiple houses, it's probably not the most prudent way to approach it.
I totally agree. It'll be hard for some people, but we'll get through it. All right, and here's another question. What is the difference between a regular cold, the flu, and COVID?
Yeah, the truth is that they could be 100% exactly the same, right? We've had people that have come in with COVID with minimal symptoms, runny nose and cough. We've had people that have come in with influenza that have had complete inability to breathe, pneumonia in both of their lungs, and a high-grade fever. And then people with allergies, actually, interestingly enough, people with allergies can have the same presentation. So really hard to differentiate. I think we're in this space and time, and we wanted to avoid this by getting the numbers down, but they're not down. And so as we go into the fall with some of the highest rates of spread that we've had in months, it's going to be really difficult to differentiate. So the healthcare providers in our systems are going to be stretched and stressed. I think, however, like I said, from a hospital standpoint, we feel confident around our testing, our clinical abilities to differentiate, and the ability to take care of patients. And so that's really the key for us. In the community, I think the initial conversation is contact your primary care doctor or go get tested if you really feel that you're at risk.
Okay. Well, that sounds great. We don't have any more attendee questions, but I wondered if you had any last comments.
Again, thank you very much for the time. I always appreciate situations like this because it allows us to reach a lot more people than a one-on-one conversation, hopefully answer their questions, hopefully get people sort of look at things differently potentially again, right? And I always tell friends and colleagues, we don't always have to agree. I think the science, the data, and healthcare sort of drives where we make these decisions. But at the end of the day, we're all in this together. We're all trying to get through this period. This is a rough period for everybody, and we have to be patient with ourselves and our children and our families from a mental health standpoint and a host of other things. We'll get through this, but it's going to take some time.
Sounds good. And then for a recap on the 4 things to do again.
Wear a mask, wash your hands, watch your temperature, and physical distance.
Very good. And we thank you so much, Dr. Alozi. This has been very educational. I just want to thank the audience also for attending. If you have any questions that you think of after the webinar, you can email them to dcolon@ephcc.org. Thank you for all your time, everyone. Have a great day. Stay safe and healthy.
Thank you, everybody. Stay blessed out there.
Thank you.